So let's talk about postoperative instructions. Most of the time, we do not need stitches to close any of the incisions that we've made. As such, you should heal very quickly, and even better, we don't have to take any stitches out after surgery. So what this does mean, however, is that you should be very careful with those incisions. We try not to futz with the eye and try not to squeeze the eye too hard after surgery. We don't want to push on the eye or rub hard. We certainly want to avoid rolling over on the pillow after cataract surgery. So for the first week, you'll notice that we gave you a shield, a plastic or a hard eye shield. That shield is usually shaped like a teardrop, and the top of the teardrop goes over the bridge of the nose like this, and you can secure it with a piece of tape or even 2 pieces of tape. We use that usually for 1 week, 7 days following the cataract surgery to protect the eye from inadvertent scratches. Now, you don't need that all the time. That's just something that we want you to wear whenever you fall asleep. We also want to make sure that you don't squeeze the eye real hard, and this can be very challenging after putting in the eye drops. Sometimes the eye drops do irritate a little bit, sometimes they sting a little bit depending on the person. Usually that's very short-lived, but we want to try to avoid squeezing the eye as much as we can. We also want to wash our hands very well. Of course, for infection, nobody wants an infection after any eye surgery. So we want to wash our hands well and try to avoid any particulate matter. Try not to touch our cat boxes or change cat boxes or walk our dogs or take out the trash. We want to be as clean as possible if we can. The third thing that we want to do is try to avoid any strenuous lifting or strenuous activity. This means anything that's going to get our heart rate up or racing, anything that's going to shake your head around or potentially move or dislodge the lens implant. We want to try and be as calm and move as slowly and smoothly as possible. We also want to try to avoid bending over. If we bend over, we can sometimes move the lens position a little bit, and that can change your vision, certainly. And rarely can it mean dislocating that lens implant and a second trip to the operating room. So we don't want to bend forward as much as we can. If we've dropped something on the ground, we prefer you squat or kneel, and of course, breathe. Anything that tightens your core muscles, any strenuous activity or strain that you place, can put pressure behind the eye, and certainly we want to avoid that as much as we can. Otherwise, for the first week, I usually like people to enjoy your vision. You can use your eyes as much as you want to, read, watch TV, that's fine. But we like you to be a couch potato, go on short walks, sure, no problem. But we try to avoid lifting things more than 10, 15 pounds if possible. Week 2, we can start to do more things. Week 2 after cataract surgery, I usually say you can start to do 50% of your maximal effort. And week 3, have at it. Do whatever you want to do and return to your normal activities. If you want to go swimming, however, submerge the eye, we do recommend that you wait about week 3 or week 4 after cataract surgery, as some of the bacteria in the water, in swimming water, is some of the most feared bacteria that we have. You may shower, however. Just try not to stand directly under the water stream. We try to keep as much water out of the eye as possible. And when you get out, just gently pat dry, very gently around the eye. Otherwise, you follow the eye drop chart. You should be given an instruction. Follow that either 2 to 4 times a day for each medication, and you'll notice that over the following 4 weeks, it's on a tapering dose. So you'll be using fewer and fewer eye drops as your eye starts to heal. The other thing that you can do is artificial tears, and feel free to use them as often as you need for any irritation that you might have. Dry eyes is very common and normal and expected to have after cataract surgery, so please keep your eyes as hydrated and lubricated as possible and go ahead and use the artificial tears. When doing your eye drops, we like that you use them about 5 or 10 minutes apart, so as you're not rinsing out the previous eye drop that you just instilled. But otherwise, we wish you a fast and speedy recovery, and we'll see you soon.